Hi everyone, welcome back. This is Dr. Buddy Donaldson, and today we're going to discuss the airway analysis with the iCat FLX. The iCat FLX or Flex does many things for us, and one of the things it does is helps us to take a look at our patient's airways. Let's take a look at two different kinds of airways. So our first patient had to have a lot of work done to get to this airway. He came to us with a CPAP machine and had a very narrow airway. He had to go through some surgery to get to here, but now his CPAP machine has been put up. Now let's take a look at this picture. Now what we want to notice is that when we look at an airway, white and blue are good. That means that you have a very good airway, and he indeed does. So after a lot of work, we were able to get his airway like this. It did require surgery for him because he was an adult. Now for children, we have a different ball game. Let's take a look at this X-ray. Now let's take a look at this young man right here. This is a young person, still has some tonsils and adenoids, and let's look at that airway. His airway is colored red. What that means is that the airway is very narrow. He and his mom reported to me that he was having migraines every day. So what we had to do, because he had a narrow palate, we used a palatal expander to widen his upper arch. After we widened his upper arch, and he was 9 years old at the time, it was the first time since he was a baby that he no longer had headaches. So this is one of the things we look at are the airways. White and blue is good, red is narrow. So that's what the iCat FLX helps us do when we're looking at someone's airway, and then we decide what's the next course of action. If you have any questions, please give us a call.